For the most part, arteries will carry oxygenated blood away from the heart. Exception that you need to know is that pulmonary arteries carry blood from the pulmonary trunk to the lungs. That will be blood that is low in oxygenated and high in carbon dioxide. The aorta is the biggest artery in the body. It's going to carry blood from the left ventricle to the body. The pulmonary arteries carry blood from the right ventricle to the lungs. After splitting off the pulmonary trunk, and we've already talked about how the coronary arteries are the first two branches off the aorta and are going to carry very rich, very oxygenated blood to the myocardium. Veins carry blood towards the heart, and in general, they are carrying deoxygenated blood, with this exception. The pulmonary veins are carrying blood that is high in oxygen and therefore low in carbon dioxide from the lungs into the left atrium. The superior and inferior vena cava will bring deoxygenated blood into the right atrium. The superior vena cava is going to drain blood from the head and the upper extremities into the right atrium, while the inferior vena cava will drain blood from the rest of the body into the right atrium. Remember that the coronary sinus, which I pointed out in the last section, will drain blood from the myocardium and dump that blood into the right atrium. It is deoxygenated blood. When we talk about the pulmonary veins that are carrying blood from the lungs into the left atrium, there are two from the right lung and two from the left lung. Here is the pulmonary circuit. And you can read through that. You need to know that. So know that sequence. There it is. Let's talk about coronary circulation. And there's a little bit on pathologies and conditions associated with coronary circulation. The heart itself is less than 1% of the body mass, but it requires about 5% of the blood. We already know that it's going to feed itself first. And we know that the first two branches off the aorta are the coronary arteries, and I've repeated that a bunch of times, so clearly it's important. During exercise, blood flow to your cardiac muscle can increase up to about 9 times your normal resting requirements. High blood pressure and the elastic recoil forces blood through the coronary arteries between the contraction of ventricles. You need to know the term anastomosis. Anastomoses is plural. An anastomosis is a network of blood vessels that will supply tissue with blood source and also provide an alternative route to tissues in case there is damage or blockage to a particular vessel. So it's kind of like a reroute or another route. Another route is probably a better term to use to provide tissue with sufficient blood supply. Having an arterial anastomosis to supply the heart is extremely important because you want your heart to keep pumping no matter what. So the pathway through the myocardium includes the coronary arteries, which are the first two branches of the aorta, into capillaries within the myocardium for gas exchange, into the cardiac veins, just carrying deoxygenated blood, into the coronary sinus, into the right atrium. And if you know everything that is in the larger font on this page, you will be in good shape. When you talk about the cardiac veins, you're talking about the great cardiac vein, the middle cardiac vein, and the posterior cardiac vein. But if you know this, coronary arteries feed the heart first, which will skinny down into smaller and smaller blood vessels until you reach the capillary level for gas exchange. And then that deoxygenated blood will flow back into larger and larger venules into the cardiac veins and then drain into the coronary sinus, which will dump that deoxygenated blood into the right atrium. This will get you through this class without trouble. But there's more information just in case you want it. We already talked about these, just giving you some images. Note this. We continually supply the cardiac muscle myocardium with oxygen and nutrients. Es muy importante. Talks about the right coronary artery, and there are going to be main branches, marginal arteries that are going to be in the, supply the right ventricle, and then the posterior interventricular artery. For me, those are nice to know. Left coronary artery, you need to know that, and these main branches are nice to know. And those show you the images. And here's our friend, coronary sinus. You should know that. Great cardiac vein, anterior cardiac veins. You do need to know this guy, which will, again, let me repeat this, take the deoxygenated blood from the heart and release it into the right atrium. Now, blood flow, spit it out, blood flow through the coronary circuit is due to changing blood pressure and elastic rebound. Left ventricular contraction is going to force blood into the aorta, which means blood pressure will increase there and the aortic walls will be stretched. When the left ventricle relaxes, pressure decreases, the aortic walls will recoil, that elastic rebound, and will push blood in both directions, either forward into the systemic circuit or backward into the coronary arteries. Pathologies, you need to know about ischemia, which is going to be reduction in blood flow, primarily due to atherosclerosis. Hypoxia is reduced oxygen to cardiac tissue because of ischemia. Angina pectoris means strangled chest. And there's a good video there put out by the American Heart Association. It is a severe pain that will accompany ischemia of the myocardium. Signs and symptoms: labored breathing, weakness, dizziness, perspiration. It'll occur when you are exerting yourself, and it will fade when you are resting. This is what can be relieved by nitroglycerin. There are differences in symptomatology between men and women. Watch that video. In fact, watch this required. Watch this video and watch this video, because there are differences in cardiovascular symptomatology between men and women, and you need to know them, and anything on those videos are fair game for the assessments. So watch those videos. You also need to know the difference between the symptomatology in men and women for myocardial infarcts, MIs, heart attacks. If you have an MI, you have death of a portion of the myocardium. It is caused either by a thrombus or an embolus, which causes blockage to a coronary artery. If the conduction system is disrupted, it may lead to sudden death. Those are the treatments, either clot-dissolving agents or heparin or angioplasty. Again, you need to watch this, because anything on, or check here, anything on this PDF is fair game for an assessment, because how men and women present when they're having an MI is different. 1 in 3 women have some form of cardiovascular disease. The rate of cardiovascular disease for females is greater than for males since 1984. Clear links to smoking, to drinking, to obesity and to diabetes. And African American women, females, have 2 times greater a chance of having cardiovascular disease than white females. And you also need to read this, we said that, read this, we said that, and read this. They don't take very, very long. Make sure you take a look at these. Anything on this or this is fair game for an assessment. And make sure you check this out too. Okay, so symptoms of MI in women. Uncomfortable, oh, you can read that. I'm going to have you read that on your own. Got to know the difference. So make sure you check out all that information that's posted there. And check that out. And more required viewing. I know I'm being so strict about this because men and women present differently. This gives you a little bit of information on atherosclerosis and arteriosclerosis. You have thickening or toughening of the arterial walls. It is a related complication for about half of U.S. deaths when it comes to cardiovascular disease. Coronary artery disease is arteriosclerosis of the coronary vessels. And you might actually have arteriosclerosis of the arteries in the brain, which can lead to strokes. It is the formation of lipid deposits in arterial walls, specifically the tunica media, as well as damage to the endothelial linings of the blood vessels. Arteriosclerosis is the most common form of atherosclerosis. It is often associated with elevated blood cholesterol. And in fact, it's not the consumption of cholesterol that is the problem. It is the overconsumption of sugar, because sugar is a key factor in inflammatory responses in humans. The problem with these is secondary to the overconsumption of sugar, but it can cause a lot of trouble. So that fatty mass, that fatty tissue mass or plaque in vessels is secondary to the inflammation or the inflammatory response due to sugar, overconsumption of sugar, but it will restrict blood flow to tissues. Coronary artery disease, it's going to have problems with blockage of the coronary circulation, going to end up with coronary ischemia, may be associated with either a thrombus or atherosclerosis in a coronary artery, and this might be treated with a stent. More info on treatment. There's a little bit of information on balloon angioplasty, which is kind of cool. High success rate, can be outpatient. There is such a thing as reperfusion damage, what does that mean? So this occurs when you have an area of tissue that has been deprived of oxygen and the blood supply is reestablished. What happens is that free radicals will develop and there will be damage, or potentially could be damage, to enzymes or neurotransmitters or neuronucleic acids or phospholipids. This is implicated in a number of other conditions, which includes Alzheimer's, Parkinson's, etc. You can read all of those. Will also contribute to aging. So it is wise to consume a good and healthy diet, which contains a lot of fresh fruits and vegetables, because they contain what are known as antioxidants, which defend the body against the damage of free radicals. Vitamin C, vitamin E, beta-carotene, and catalase, which is an enzyme.